Dr. Vishnu. I work for Lotus Eye Hospital here in Kochi. So I'm today going to talk to you about glaucoma. Glaucoma is nothing but intraocular pressure of the eyeball. The increased pressure of the eyeball, like the body pressure, blood pressure, this is the increased pressure of the eyeball. What it does is to the patient and to the doctor, two ways you can deal with it. Because this disease, glaucoma, is a silent thief of vision. So after 40 years of age, there is a 40 to 30% of the population has to be screened for glaucoma. Why I say that is, it's a silent disease, as I said before. So once the disease starts at 40-50 years of age, at 60-70 years of age, they'll understand, the patient understands there's a problem. So that's why the point of the diagnosis of the disease, that point the patient also can't do anything, the doctor also not able to do anything, so when the vision is lost. So prevention is better for glaucoma. That's why the awareness for the glaucoma disease, everybody is a little worried about it. And genetically in the family, the glaucomas can come through. Like one generation has glaucoma, next generation has a high predisposition for glaucoma. The screening at 40 years, coming to the screening. So screening at 40 years will require 2-3 tests. That test will be done in the doctor's office, where we'll be checking the eye pressure of the eyeball, and then followed by the water exit pathway of the eyeball, and then a dark room test, where you'll be analyzing 5 minutes for one eye, 5 minutes for the other eye, the ability of the eye when looking straight ahead, the side vision, peripheral vision, how much is it. So in glaucoma, the peripheral vision is lost a little bit. So that's why the central vision is fine and the patient is very happy and they don't have any symptoms or signs. But the doctor finds out that the vision in the periphery is lost a little bit slowly over a period of 10 to 20 years, very slowly. It is not a very fast process. So few glaucomas are there in a younger age group also, like 10-20 years, or childhood glaucomas, 1 year of age also. But the most common is like 40 years and above. The different types of glaucoma has to be understood in a clinical workup. So the patient has to go to the doctor to understand and diagnose the disease, one thing. And the second thing, systemically, if the patient has some other problem, like a heart problem, like a vascular disease, like the blood supply is affected, then glaucomas also can be manifested. So one, full eye examination followed by a systemic workup is very important as the patient goes above 40-50 years of age, if they have a family history of glaucoma. Pretty much this is the way to approach a glaucoma analysis, but treatment will differ according to the diagnosis what we come to. The most common varieties, if you want to put it, as open angle glaucoma, closed angle glaucoma, where the water exit pathway is a little open but still it's not functioning, the water exit pathway. The closed angle variety, where the exit pathway is structurally closed, the water exit pathway. So open angle and closed angle is the most common varieties of glaucomas. So after that, medical treatment is possible by lifelong drops, so much adherence to the treatment what the doctor says if the diagnosis is made. As the end stage, the glaucoma can be treated very easily, and there is no reversal of the treatment like cataract or any retinal diseases. So glaucoma picked up early, much better. And then coming to the surgical treatment for glaucoma, it is helping us make the glaucoma damage not go in excess. Whatever damage has occurred, it keeps the eyeball little safer at that point. So medical management is useful to keep the disease away and keep the eyeball pressure little low. Surgical disease is like a palliative care, like in cancer. So early pickup of the disease much better than picking it up late. So again and again I would come to only the same thing, which is like nothing but screening of a glaucoma and the family members of the person who is diagnosed to have glaucoma.
Lotus Eye Hospital and Institute.